Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and preparing well for upcoming nursing competitive exams. In Metier, they have started a new batch for the upcoming NORCET exam. So kindly join because the date is the admission date is going to close. So kindly join as soon as possible and utilize the opportunity and crack the exams. Okay. In YouTube Metier channel, we are posting important topics as well as important MCQ for the nursing competitive exam. So kindly subscribe and follow our channel. Okay. Okay. We'll start today's session with a small quote. Success does not lie in the results, but in efforts. Being the best is not so important. Doing the best is all that matters. Okay. Success is not on the results. Don't look for the results. Put your efforts. The results automatically will come. Being is the best is not important. Whatever you are doing, that should be a best. Okay. சக்சஸ் வந்து உங்களோட முடிவுகளை எதிர்பார்த்து இருக்கக்கூடாது. உங்களுடைய உழைப்புல தான் இருக்கணும். உழைப்பு ஆட்டோமேட்டிக்கா உங்களுடைய ரிசல்ட்ஸை கொடுக்கும். ஓகேவா? நீங்க பெஸ்டா இருக்கிறத விட பெஸ்டா உழைக்கணும். ஓகேவா? நீங்க பெஸ்டா உழைச்சிங்கன்னா ஆட்டோமேட்டிக்கா நீங்க பெஸ்டா மாறிடுவீங்க. ஓகே ஓகே வில் ஸ்டார்ட் டுடே செஷன். டுடே வி ஆர் கோயிங் டு see about maternity related question. Okay, maternity nursing questions we are going to see. Okay, so all the questions are very basic only, but in that other options also we are going to discuss so that you can answer it easily. Okay, the color of amniotic fluid is, the options they given: clear, pale, straw color, dark color, yellow color, none. Easy, very easy. Everybody knows it is a clear, pale, straw color urine. What are the abnormal can be happen in the amniotic fluid? Abnormal color changes in the amniotic fluid. Green color means fetal distress because the child has passed the meconium. That's why that amniotic fluid is green color. What are the conditions this meconium can be fast? Fetal distress, breech presentation or transverse lie, and the listeria infections. All these conditions, the amniotic color will be green color because of the meconium passing. Next, golden color, that indicating bilirubin. So RH isoimmunization. Okay. RH isoimmunization leads to the gold color amniotic fluid. The tobacco juice color or brownish color, it indicating intrauterine death of the uterus. Then saffron color or yellowish green, that indicating post-term pregnancy. Yellowish green. Don't confuse here. Green means it is not a fetal distress. Yellowish green or saffron color, that indicating post-term pregnancy. Then dark color indicating concealed hemorrhage or abruptio placenta. Clear? So like that, you have to study all the amniotic fluid. What are the abnormal colors also? The normal is clear, pale, straw color. That is a normal color. Clear? Yes. Next question. The umbilical cord, otherwise known as what? Easy. It is Funis. What is meant by Funis? It is a Latin word. Funis means it's a cord, a lengthy cord. That is indicating Funis. Okay. What are the other name for the umbilical cord other than Funis? Navel string, birth cord, that short form of the funiculus only, Funis. Okay, funiculus, that is Funis, or umbilicalis. Funiculus umbilicalis, that is a short form for Funis. So many names for the umbilical cord. What are they? Navel string, birth cord, funiculus umbilicalis, or Funis. So many words are there. Clear? So what are the other name for the fallopian tube? Fallopian tube is otherwise called oviduct or uterine tube. Oviduct. Duct means tube. Okay. Then euchard, that is for just for the confusion purpose they have given. What is the other name for placenta? Placenta is known as after birth, because after the baby is expelled from the uterus, then only the placenta will come out. So that is other name for the placenta is after birth. Okay. So now we know other name for the each part of the uterus as well as placenta and the umbilical cord. Clear? Yes. Next question. The appearance of violet blue discolorization of the vaginal membrane after the conception is known as what? The symptoms, the options: Egas sign, Osiander sign, quickening, Jacquemus sign. So what is the, this scenario, this question is telling about which sign they are asking. Well, Egas, Osiander, quickening, Jacquemus sign. So these are the pregnancy after the woman is get pregnant, after the conception, there will be changes will happen in the uterus, right? So these signs and all related to that changes in the uterus. ஓகேவா? பிரெக்னன்ட் ஆனதுக்கு அப்புறம் ஒரு மதரோட யூட்ரஸ்ல பல சேஞ்சஸ்கள் நடக்கும் பிசியலாஜிக்கலா. ஸோ ஒரு சேஞ்சஸுமே ஒரு சைனை கொடுக்கும். ஓகேவா? ஸோ இங்க என்ன கேட்டிருக்காங்க? வயலட் ப்ளூ டிஸ்கலரைசேஷன் ஆஃப் த வெஜினல் மெம்பரேன். So what is that sign? So the correct answer is Jacquemus sign. Don't confuse. Jacquemus sign is otherwise known as Chadwick sign. So two names for this: the Chadwick sign or Jacquemus sign. What it is? So when you do the examination of the vagina, the anterior and the vestibule vaginal wall become blue in color. Usually after the first trimester, during the first trimester. Okay. That means 8th week onwards, we can see this Jacquemus sign, otherwise called Chadwick sign. What is Egas sign? Option A. Egas sign is nothing but softening of the lower part of the uterus. When you do the abdominal finger vaginal examination, that time you can feel the softening of the lower segment of the part, uterus part. Okay, that is Egas sign. What is Osiander sign? While you are doing the abdominal examination or a vaginal examination, you can feel the pulsation in the lateral fornix due to the increased vascularity. The woman also can feel that pulsation. Sometimes we feel the palpitation in heart. Like that, there is a pulsation the mother can feel in the lateral fornix due to the increased vascularity. That is Osiander sign. What is quickening? This is a first fetal movement that is called quickening. Everybody knows it is as early as we can the multigravida woman feel at 16th week, and the primary gravida after the 18 weeks only they will feel, they can identify the movement, okay, clearly. So that is quickening, feeling of fetal movement. Clear? Okay. So according to this question, the answer is option D, Jacquemus sign, otherwise called Chadwick sign. Next. Question number 4. The pregnant woman complains of numbness and pins and needles in her fingers and hands. The condition is known as what? Options: carpal tunnel syndrome, varicosities, pica, heartburn. Definitely it's not pica, heartburn. Varicosities or carpal tunnel syndrome. In varicosities, we won't feel any numbness, pins and needles. There will be pain will be there, swelling will be there, redness will be there during the varicosity. Or visibly we can see the veins. So it is not an option. So correct option is option A, carpal tunnel syndrome. Sorry, okay, carpal tunnel syndrome. What is carpal tunnel syndrome? Whenever the muscles getting growth or something is compressing the median nerve, that leads to the numbness or pins and needles in the hand. Okay, that is carpal. Why it's happening to the pregnant woman? Because of due to the hormonal changes, the body fluids will build up in the hand, especially in the wrist. Okay, that will compress the median nerve. Not only that, because of the growing uterus or growing breast during the pregnancy period, that can compress the median nerve in the axilla also, and the ribs also get compressed. So because of the compression, the median nerve, that leads to the carpal tunnel syndrome. Varicosities, why it's happening in the pregnant woman? Because of the hormonal changes, the blood become very thick, right? Very thick, and the edema also will happen. That can lead to the varicosities. Pica, why it's pica? What does mean pica? The woman will be craving for the non-food substances, right? Like ashes like that. She wants to eat. Why it is happening? Because of the hormonal changes only, and nutritional deficiency will happen in the body, especially iron and zinc. That leads to the pica. Okay. Then heartburn, because of the growing growing uterus that can compress the stomach. That also can lead to heartburn. And due to the progesterone secretions in the body, that will loosen the esophageal sphincter. That sphincter contraction will be very low. So that can also lead to the heartburn. Clear? So according to this question, it's a carpal tunnel syndrome. Next question and last questions. The hormone oxytocin is secreted by uterus, vagina, ovary, posterior pituitary gland. Here, you don't think that it is from the uterus or ovary, okay? It is by the posterior pituitary gland, okay? We have anterior and posterior pituitary gland. And anterior, you know, what are the secretions, TSH, ACTH, and so many things, growth hormone and all there. Posterior, it's mainly secreting the oxytocin and antidiuretic hormone, okay? Okay, that's all about today's session. Thank you so much. I hope the class was helpful. It's very basic only, okay, because so many of you asked regarding to put up basic questions. So don't forget the basics, okay? So sometimes what will happen, we study very detailedly about all the questions, very detailedly, very hard questions, but we forget the basics. So that is why for the last 3-4 session, I am taking the basic questions. In upcoming videos, we'll put an advanced questions and all. Thank you all and all the best.